So I've been at this hospital probably 4 or 5 months after they finished when I came into practice here, and it's been nothing but a pleasure. It's the patient population up here from Odessa, certainly from the Keystone or Lake Keystone area, and Lutz has been phenomenal. People are appreciative. They say thank you. For the most part, they actually listen to what I say and do what I do, and at the end of the day, as I said, they say thank you, and that's always kind of the best part. Now, is it Women's Health Month? I thought every month was Women's Month. That's what my wife tells me. As a urologic surgeon, I pretty much handle anything that essentially urine comes in touch with, from starting at the top of the kidneys down to the level of the urethra. When I was in training, I really was, or before I started training, I was really felt like I was going to be mostly dealing with men's urologic surgery, men's urologic health. And I was amazed when I started practice how many females I was seeing. And probably 30 to 40% of my patient population are females. And it's been sort of interesting, like many things in life, my female appointments are much longer and much more complicated than my men's. And it's because they ask poignant questions. They're not satisfied with medications that I prescribe without asking about side effects and profiles, et cetera. And they tend to be a little bit more intuitive and less just accepting of what the doctor says. So it presents a unique challenge for me, but also it's a joy to take care of that patient population, and I am happy to entertain women in our practice. The couple of things I'd kind of briefly like to talk about today are one, sex, and number two, I'd like to talk about women's voiding dysfunction. And we'll start with the more mundane topic first, which is women's voiding dysfunction. Women can have, and keeping in mind that a lot of what I do probably 30% of what I do has to do with cancer, cancer of the kidneys, cancer of the external genitalia, particularly obviously in the males, and prostate cancer. But a lot of what I deal as it pertains to voiding dysfunction both in men and women. In men, it's a lot of things related to benign prostatic hyperplasia. Fortunately, females don't have a prostate, which mostly just causes mischief for men. In women, the problem tends to be during aging. You have some things that make your lives more difficult, and usually this is related to gravity and time. And the problem is that as you've had multiple children, and as you go through premenopause, perimenopause, and of course menopause, your estrogen starts being produced. Some of you have had hysterectomies, and of course you're no longer having the need for progesterone as well. And coupled with the fact that you have some pelvic floor laxity, everything in the fruit bowl of your pelvis is competing for the path of least resistance, and that's through your introitus, or your vaginal opening. And as a result of that, sometimes women can experience things called prolapse. And prolapse is basically some of your pelvic floor organs which are coming out of the inside of your introitus. And I frequently ask women in my office, do you have any signs or symptoms of pelvic organ prolapse? And the 30-year-old women look at me and they say, what? And I explain what it is, and they make this awful face. It's like, what, my bladder's falling out of my vagina? I'm like, yeah, does that ever happen? They're like, of course not. And they look at me like, thoroughly disgusted. My 6-year-old women, they know exactly what I'm talking about, and many of them nod their head and they say, yes, that's just kind of part of what I do. And so they sort of understand what I'm talking about. But there's some sort of age discrepancies on how people react to things. Some of the reasons why there's pelvic floor laxity, again, is because of hormone depletion, gravity, increased weight. As women age, they tend to increase more weight, particularly in the pelvic area, and as well as having multiple children. What happens is some of the good rigid pelvic floor suspension that you have is no longer there. The elastic fibers, the collagen, all that stuff starts to decrease with age. And as a result of that, women can have some of their pelvic organs prolapse. You can have your bladder pushing out. You can have your rectum pushing out. You can have your uterus pushing out. You can have portions of your small bowels pushing out, called an enterocele. And more often than not, women will have things called cystoceles, but sometimes rectoceles will be concomitant, or you'll have a mixture of all of the above. And so those are surgical problems, okay? We can talk about pelvic floor therapy and conservative measures, or putting these actually manufactured devices up in the introitus to support these pelvic organs in non-surgical candidates, but it's really primarily a surgical problem for a pelvic floor surgeon, usually a urologist or urogynecologist, and sometimes just gynecologists will take care of these issues. And so I'll kind of leave it at that, but really the signs and symptoms of pelvic organ prolapse or protrusion, sometimes tenesmus or constipation, okay, straining with defecation, and sometimes women will actually have the need to strain when they void or urinate. And that's really kind of pushing or having to lean forward to empty out because that bladder might be pushing and kinking off your urethra, okay? So those are all reasons to go see a urologist or maybe even start with a gynecologist about it. The other thing I wanted to talk about, urinary incontinence. There's several different kinds, and there's also a mixture of these. The first one is what we call genuine stress urinary incontinence. And this is simply related to, if you could picture, the female urethra is about 2 centimeters, okay? Males have obviously longer urethras. And essentially there is a backboard of a ligament underneath that, and as women cough or bear down, basically there's a good backboard, so it kind of squeezes off or pinches or coapts, as we say, to prevent urine from leaking out. With aging, hormone depletion, etc., women sometimes have laxity in that backboard, and it will give as a woman will cough, sneeze, pick up a grandchild, try to do Zumba, go running, all these sorts of things. And sometimes urine will leak out. Sometimes just a little bit of urine will trickle into urethra, which sends a trigger to the brain and the autonomic nervous system, which says, hey, I need to pee because there's some urine in my urethra, and all of a sudden there will be sort of a reflex and women will urinate. And so what we do for this is we can do conservative therapies with topical estrogen creams, which don't work as well. We can try pelvic floor therapy and exercises, things called Kegel exercises. But a lot of times this is primarily a primary surgical problem. You can't turn on the TV these days, unfortunately, particularly on late night TV, without seeing an ad about actos and bladder cancer. And the next commercial is about a transvaginal tape and erosion related to some sort of incontinence surgery for women. And it's frustrating for me, but I spend about 30% of my time talking to women and counseling them about these mesh issues. It's not to say that they're unwarranted, unfounded. Matter of fact, I was attending a surgical workshop as a cadaver lab this past weekend downtown, and there's been a 3,000-fold increase in the number of these surgeries that have been going on in the past 10 years. It's truly remarkable. Industry has pushed it. There's a big consumer bias toward it, and a lot of physicians who would not otherwise be considered pelvic floor surgeons are doing this. The interesting thing is while the absolute number of complications have increased, the percentage of complications has not increased. So we're just seeing a sum total increase. However, malpractice attorneys and medical legal environment, it's sort of become their platform, and they cast their net wide. So we have to react to it. And there are FDA regulations and some panel discussions about this. The bottom line is I will use mesh on female incontinence repair. There are other things like bovine, cow, or cadaveric fasciolata. There are other ways to sort of try to achieve the same thing, but mesh works. Mesh technology is excellent and certainly come a long way in the past 10, 20 years. And I just have to walk through patients through that whole process. But it's been a little bit more challenging. So that's how we address female stress incontinence. There's another kind called urge urinary incontinence. And when my females come in, they say, "Doctor, I leak." I say, "Okay, well, how do you leak? Do you leak when you pick up your grandchild, when you're lifting up groceries, when you're laughing, when you have an upper respiratory tract infection?" Well, no. Do you leak are you a person who, when you drive to the mall, you're constantly looking for the bathrooms? Yeah, that's me. Are you a person who can't sit through a movie, or you can't drive to Gainesville without pulling over? Yeah, that's me. I will have these people go home and do some homework where I have them do a voiding diary, and they have to sit down and write down in lieu of an expensive test in my office. They'll write down how often they go. And it's amazing to me how, when these patients write it out, the volumes that they go and how frequently they go. And this is something, overactive bladder syndrome, which is about 17 million women have in America. it's a vexing problem, and it can be very disruptive. I had a young lady who worked at Verizon recently, and she's being fired from her job because she was going to the bathroom so frequently. There's a social stigma to it. We don't talk about it at cocktail parties. We can talk about her heart attack. Guys don't talk about their erectile dysfunction, although some do. And so women don't like to sort of talk about their urge urinary incontinence. And a lot of times we don't quite know what the cause of that is, and we say it's idiopathic. It means the doctor's the idiot. We don't quite know. But there is something about the micturition reflex in our brain, or perhaps a small capacity bladder, which makes women, and sometimes men, but more frequently women, feel the need to go to the bathroom quite frequently. For treatment for those things, so sort of, again, the symptoms of that are urinary frequency, urgency, going to the bathroom small quantities, nocturia, or going to the bathroom at night. So for these things, the first thing I start with women is I say, how much coffee do you drink? How much Mountain Dew do you drink? How many phenols? So how much red wine? Is it 10 minutes? Wow, that was quick. And so briefly, there are conservative measures to help these women, and that's my primary goal, is to try to figure out non-pharmacologic ways to help these women. Many will fail those, and they require a medicine like a BayCare or Enablex. And then ultimately, there are other therapies like neuromodulation, which can help. So I'll leave it right there. I was, sorry, piqued your interest with sex. One of the greatest things about having my family, now I got 2 more minutes. I learn all about 50 Shades of Grey, but when I have females in my office, and every time a female's reading a Kindle, I know she's reading 50 Shades of Grey, because she doesn't want anybody to read the top of the book. But women will frequently come to me and talk about dyspareunia, which is pain with intercourse, and it happens with all my postmenopausal women whose husbands still have erect penises or finding an erect penis somewhere, and it's because they're having vaginal dryness related to hormone depletion. And so I frequently do that. I will provide testosterone to help women's libido. It should be about 1/10 of what a male's is. Women are like, testosterone, I don't want to be hairy and horny. I was like, oh, okay, I understand that. But we can sort of do some hormone manipulation, and we can provide estrogen cream and manipulate some hormones to help with that very, very important quality of life. Thank you.